Most people turning 65 think Medicare is about comparing plans. It's not. At age 65, there are only 3 decisions that actually matter, and the order that you make them in can quietly determine what options you have 5 or 10 years from now. Not because Medicare is unfair, but because Medicare is structural. At age 65, you have leverage. You are evaluating Medicare. After age 65, the Medicare system may start evaluating you instead. The tables turn. Today, I'm not going to define Medicare Parts A, B, C, and D. What I'm going to do is show you the 3 decisions that truly matter and why the order matters and which one people regret the most by the time they turn 70. So let's start with the first one. At 65, Medicare is unusually forgiving. You can enroll without medical underwriting, you can choose coverage structures freely, and you have leverage, and that is important. Here's what most people don't realize. The difference between enrolling at age 65 and trying to change things when you reach 70 isn't just paperwork. It can be medical underwriting. After your initial enrollment window, Medicare doesn't disappear, but Medicare's flexibility narrows. Now, people often assume, I'll just try something and then switch later. Well, sometimes you can, sometimes you can't. And that sometimes is where many people get surprised and feel stuck. Because the rules depend on what you choose, where you live, and whether your health has deteriorated. At 65, the system assumes nothing about you. At 70, it might. And that's why timing is the first decision, not the plan. Timing determines how many doors stay open. Now, here's what makes this even more important. Even if you enroll at the right time, you can still limit your flexibility depending on how you structure Medicare. And that brings us to decision number 2. And this is the big one. Original Medicare or Medicare Advantage? Now, most people compare benefits or premiums, and that's surface level. The real difference is the risk structure. Original Medicare gives you broad provider access. You can add a supplement to reduce unpredictable costs. Medicare Advantage bundles coverage into a managed plan operated by a public insurance company beholden to their shareholders. Often lower premiums up front for a Medicare Advantage plan, but your networks are defined and cost-sharing structures are also defined by the insurance company. And annual out-of-pocket limits can change every year. Neither is automatically right or wrong, but here's the micro mistake people make. They decide based on this year, not 5 years from now. So let me give you the real trade-off. Original Medicare with a supplement prioritizes provider freedom and long-term structural stability. Medicare Advantage prioritizes integrated management and annual cost ceilings, different philosophies, different risk models. People assume that if I don't like it, I'll just switch, and that is not always so simple. In most states, switching from a Medicare Advantage plan to a Medicare supplement later requires you to pass medical underwriting, which means your health may determine your future options. If you start with a supplement at age 65, you often secure the right to keep it as long as you pay the premium. No one can cancel it. No one can reduce the benefits. That's not an option, and that's the structure. So this decision isn't about which plan is better. It's about which trade-off you are consciously choosing. And that leads directly to the third decision, the one that determines how predictable your retirement feels financially. Even once you've chosen original Medicare, if that's your choice, you're not finished. Now you're deciding how much financial uncertainty that you want in retirement. Now, many people default to Plan G. It's comprehensive, it's popular, but its popularity doesn't necessarily equal personal fit. So here's the deeper question. How much price variability are you comfortable with or can you tolerate over time? Some people prefer predictability even if premiums gradually increase. Others are comfortable with occasional out-of-pocket exposure in exchange for lower monthly costs. But here's what you're actually deciding. At 65, you're not just choosing coverage, you're choosing how much uncertainty that you want in retirement. And that affects budget stability, switching flexibility, long-term planning. Most people rush this decision without realizing it affects the next 20 years. And if this type of explanation helps you think clearly, not emotionally, not politically, just structurally, subscribe to this channel, because Medicare is not complicated, it's just layered. And the more you understand the structure, the fewer decisions that you'll regret later. I release weekly videos that help you think long-term about Medicare. If that's valuable to you, please subscribe. So let's simplify this. There are 3 decisions that actually matter at 65. The first is timing. The second is structure. And the third is your supplement strategy. In that order. If you reverse that order, you end up choosing plans before you understand the flexibility. And flexibility determines your future options 5 or 10 years from now. If you'd like to see what I chose when I turned 65, so watch the video that should be linked on your screen now, or it'll be also in the show notes and the first comment section. And coming up soon, I'm going to show you what Medicare doesn't cover and why that matters, even if you've already enrolled. I'm Matthew Clausen with Medigap Seminars. I'll see you in the next video.